don't lose hope. And I think what often happens is when you get to a level of quite depleted and quite defeated space in terms of your pain, know that the only way forward is up. So take a leap of faith. You are not alone. Small changes make a huge difference.
Oats that you buy in the shops.
Just straight rolled oats, $1.20 a big pack. He was ready.
Yeah.
But sometimes people are just on the fence in their pre-contemplation going, yes, no. And I guess as a health professional, you need to really gauge where a person's at. And instead of wrestling with them, dance with them a little and then challenge them a little bit. And social media and TikTok are just through the roof at the moment in terms of what works for some person is going to work for the rest of the world.
What's the one thing that pops into your mind, like the top thing that you go, oh my, whilst a medication might help, an injection might help, the thing that's going to help the most is, welcome back everyone to the Pain Diaries podcast, where we unpack the reality of living with and treating chronic pain. One story, one expert, one honest conversation at a time. My name is Nick Christelis and I'm your host. I've had many patients over the years come to see me and say to me, I've had a couple of glasses of wine and my pain is all over the place. And this is absolutely true. Wine promotes inflammation. And on the flip side of that, what other things you put into your body may treat inflammation, reduce inflammation. And I've spoken to a lot of patients over the years to say, you need to see a dietitian because there's so many things you can do with your diet to improve your pain. And I've had no's so many times. So today, what we're doing is we're bringing the dietitian to you. To help make sense of it all, I've invited Sherie to the pod. She's an experienced dietitian, an experienced pain dietitian here at Pain Specialists Australia, and an amazing person to be around to walk us through these important topics. Hi, Sherie.
Hi, Nick. How are you?
Good. Thanks very much for your time.
Thanks.
So what I want to do today is 4 things. I want to discuss food and inflammation and the connection. I want to discuss the inflammatory diet, anti-inflammatory diet. Let's look at some myths, some pitfalls, some misconceptions. And most importantly, I want people listening to this podcast to take away practical advice they can start using today. So, firstly, Sherie, who is this episode for? Who would benefit from listening to this?
I guess being in a pain specialist umbrella, anyone experiencing pain, chronic pain, as a result of an injury, as a result of, I guess, a condition that they may have that's pre-existing, someone who's carrying excess weight, someone's got diabetes, fibromyalgia, chronic fatigue, I guess gut issues as well, people who are experiencing inflammatory bowel disease, irritable bowel disease, FODMAPs. I guess nutrition's really everyone's business. And we should all be leading a life of anti-inflammatory, really, because we don't know what's happening on the inside of our body. And so we are what we eat. So I guess this episode is, the target audience for this episode would be really anyone living with pain, chronic pain, acute pain, anyone with conditions that I guess they feel like they would like to kind of go that little bit extra, that little bit further. And once again, nutrition's everyone's business. So really anyone entertaining this episode should really be listening.
Good. What is a dietitian? What do you do?
Good question. I guess I'm not the food police, which is a lot of people think, because the word dietitian means I'm going to put people on a diet. And often dietitians will probably change that on its head and call themselves nutritionists or food coaches or health coaches, just to kind of reduce that stigma around nutrition. But a dietitian essentially is a person with a university degree, a postgraduate degree in health, in nutrition, in food, around well-being, around proactivity, so being proactive in terms of your health, your nutrition, your well-being, and I guess where the world is heading at the moment with longevity in terms of your health. And I guess the other part of it is if you've got a chronic condition or if you've got an underlying condition that requires nutritional management, that's where a dietitian would help. So a dietitian, where I see a dietitian, is integrating into a multidisciplinary team so that we're a one-stop shop for a client managing their health. And my area of specialty is food, nutrition, pain, diabetes, whatever it may be, to help support, educate, give you, I guess, feedback, but not the food police.
Not the food police. I like that. All right, let's dive into the first area. That's the first section, which is food and pain and the connection. So this is going to be a little scientific. I'm just going to give you a bit of a view on how this all ties together. Essentially, when your body gets injured, when you have a surgery, an inflammation, an injury of some kind, what happens is the body naturally releases what we call pro-inflammatory mediators, such as cytokines, prostaglandins, bradykinins. Effectively, these are chemicals that bathe nerves, peripheral nerves in your body, and make them more responsive to stimuli. So what happens is the nerves become sensitized, you feel pain more, your body senses this inflammation, and that's good because that allows tissue healing. Now that's, as I said, called peripheral sensitization, and that's normal. Over time, that all settles down. But in the chronic pain states, what happens is this inflammatory signaling continues well after the healing process. And so you get this ongoing, long-standing nerve nociceptor activation and excitability. And that's called central sensitization. So the central nervous system, the brain, all the nerves really they amplify pain. That's essentially what sensitization is, the amplification of pain. So light touch hurts. Pain is felt excessively. That's called hyperalgesia. Light touch, when it hurts, it's called allodynia. And also, because of all this inflammation, your body's natural ability to suppress these pain signals disappears. So you've got less suppression and more excitation. So you get into this state of ongoing pain. So that's inflammation and how important inflammation is in the chronic pain state. And of course, other inflammatory conditions like CRPS, arthritis, rheumatoid arthritis. So my question to you, Sherie, is what foods do we eat nowadays, or what's available to us that actually worsens inflammation?
Yes, thanks for that. So I guess foods that worsen or I guess suppress inflammation, from a food perspective, because it's a lifestyle change, there isn't one specific food, if you have it, will give you a heightened level of pain. It's more that lifestyle and that way of eating over time that will heighten your levels of inflammation, your inflammatory markers, etc. So I guess when we're looking at the lifestyle that we're in, we're all kind of trying to live a healthy lifestyle, but we're also in a fast-paced lifestyle. We've got whatever it may be, other commitments, whether it's food, whether it's family, whether it's sport, whether it's work, whether it's travel. So I guess we want to make the healthy choice the easy choice. But what ends up happening is sometimes as humans, we cut corners. And so there are some foods that will heighten the level of inflammation over time. And those are foods that we consider pro-inflammatory. So they exacerbate the inflammatory markers. And there are other foods that are anti-inflammatory, which will suppress the inflammation. So on its own, it won't that specific food will heighten or suppress, but overall, over time, in a holistic approach. So the foods that tend to kind of heighten, exacerbate inflammation will be foods that are high in animal fats. And why so? Because animal fats tend to carry saturated fats. And saturated fats emerging evidence shows that saturated fats heightens the level of inflammation. What is that? So things like animal protein, so, red meats, your white meats, things like that. Things like your full cream dairy, things like your deli meats, things like, that's in terms of the saturated fat. It doesn't mean we suppress them, we don't have them at all, but like we're saying, it's part of a lifestyle. We don't make them the mover and groover of our every single meal. The other thing that tends to kind of be heightened in terms of inflammation is refined carbohydrates. So by refined carbohydrates, I don't mean carbohydrate free, no carbohydrates. I mean carbohydrates that are refined, don't come in their natural form. So added sugars, confectionery, white flour, white bread, those kind of foods tend to heighten the level of inflammation. Why? Because they're what we call high GI, high glycemic index. They break down quite quickly. They give us a spike. And so if we've already got central sensitization, or if we've already got, quite sensitive in terms of our pain, that's just going to exacerbate it further.
Right. What about alcohol? Where does alcohol fit?
Yes, good question, Nick. So alcohol in the short, in the social setting, in the one-off, not a big deal. But if it's becoming a regular part of our lifestyle, two things are happening. It's taking place from something else we could be having that's healthier for us, firstly. Secondly, it does trigger and exacerbate inflammation further because of the tannins in them, because of the natural ingredient being alcohol. The body identifies alcohol as a toxin, so it wants to kind of get rid of it. So alcohol is something that we would try to have scarcely, but knowing that chronic pain is something that we live with for quite some time, and sometimes we just need to take that edge off. We need to find that happy medium.
Yeah. I've had a lot of people over the years that have turned to drinking to cope with pain.
Yeah.
How do you approach that? What do you say to patients?
Yeah, I guess the fact that they've come to see me in the first place is something that shows that they're willing to take that next step. And I guess with alcohol, it's like you said, it's a coping mechanism. So I guess people don't intentionally mean to sabotage their health and, exacerbate their pain further. If they knew it was exacerbating their pain further, they would probably not wish that for themselves. So how I would address that with them is not necessarily tell them, cut it out completely, because clearly it's serving a purpose for them in terms of, I guess, deterring from their pain. And often what I find is when someone is consuming quite large amounts of alcohol to cope with their pain, sometimes it's a result of removing something else and replacing it with alcohol. So for example, they would have been smoking and they've cut out smoking because they know that there's no direct benefit for them in that. So I guess what I would do with them is slowly wean them off the alcohol and find other methods of coping in terms of pain. And educating, education is a huge part of behavior change, but just because we know doesn't mean we do. So I guess informing them, giving them options around what we can replace it with, reducing the quantity, finding little tricks of the trade. So often with alcohol, what I would say is do like an aperitivo type of alcohol. So instead of, mixing some wine with some sparkling water, having a glass of water in between a glass of wine. So, when we're physically nourished and we're physically full, sometimes taking that extra little bit of fluid is not something we would want for ourselves.
I suppose it's making those small little behavioral changes, because it's really hard to make these massive changes to lifestyle, isn't it?
Absolutely. Absolutely, Nick.
What conditions would improve with dietary modification or dietary changes? Are there specific conditions that might improve, or tell us about that, or give us a patient story where you've had a beneficial outcome?
Thanks, Nick. I guess with nutrition, it's improving our nutrition is going to improve our health, full stop. And when we've got something like chronic pain, heightened level of inflammation, and then that heightened level of inflammation goes from localized to centralized, we do know that nutrition is part of the puzzle to support a person with chronic pain to reduce the inflammation and in result reduce the pain. So people that would directly impact and be influenced by that are people that are living with a chronic pain condition. So, or as a result of a pre-existing condition or a result of an injury, for example. So people who have chronic migraines, people who have fibromyalgia, people who have diabetes, people who have celiac disease, people who have gut issues, people who have an injury that's obviously resulted in localized pain and then centralized pain. Food becomes that go-to in terms of comfort. So in relation to food, improving nutrition, there's a lot of benefit in that. And I can think of a person who I actually saw recently who exhibited so much improvement that's beyond his and my expectations, really. Not that I expect anything of anybody, it's whatever you can do. But it's a person who is seeing us at the pain specialist clinic. He sees a multidisciplinary team. So that's a big tick, first of all, because with chronic pain, you need a multidisciplinary team. There is no one size fits all. So obviously we all integrate our education and our advice to him and to them. But yeah, he came in with psoriatic arthritis, osteoarthritis, and carrying quite a bit of central adiposity in the abdomen area. He lives in a warmer climate because he finds that helps manage his pain. But he obviously is willing to take that next step to improve his health and nutrition because he's still it's not cutting the edge for him. So he saw me and he took that risk and he took that leap of faith because, in his mind, he's like, dietitian, like you said, Nick, no, what's she going to do? She's going to restrict my food choices. I've already got enough issues that I'm dealing with in regards to my pain. So I humbly and simply put things in front of him without, no slaps on the wrist, no judgment on his end. But we went down the route of the Mediterranean diet. And the Mediterranean diet has been around for a very long time, and it's got so much benefit, and there's a lot of emerging evidence, a lot of published evidence around the Mediterranean diet and its improvement in inflammation, inflammatory markers, and as a result, chronic pain. And for him, he's got a chronic pain issue that he lives with and he's having to deal with on a day-to-day basis. So it's not going to go away, but it can be better managed. And that's one thing we need to kind of emphasize to people.
So what things was he doing not wrong, but what things could have been improved upon, and what did he end up doing? What little things did you change?
So little steps, and that's the thing. Rome wasn't built in a day, and I'm always big on the small changes that make the huge difference. So he was having the equivalent of about 20 super dupers, which are those, I guess they're like icy poles. Long icy poles, 20 of those a day, because one, he enjoyed the quenching of them.
Yeah.
He liked the fact that it was, I guess, deterring away from his pain, short term, obviously. But he knew that it probably wasn't the best for him. He didn't realize it wasn't the best in terms of his pain. He just realized it wasn't the best for him. And when we turned it on its head and said, it's got nothing to do, obviously it's got a lot to do with calories and weight, but it's got a lot to do with inflammation as well. And his priority was trying to reduce the inflammation. So we went down that alley. So we said, I didn't necessarily say to him, cut it out completely, but in 3 months' time, he cut it out completely. Refined carbohydrates, added sugars, super dupers. He was having 20 of those a day. One super duper has the equivalent of about 7 to 10 grams of sugar, which is about 2 teaspoons of sugar. So you can do the math.
20 to 40 teaspoons of sugar a day, essentially.
A day. Yeah, and that's just in his super dupers, his icy poles.
What other things could have been improved upon for him?
Yeah, so he actually cut those out completely.
Gone.
Yeah, I just informed him and educated him about the impact of it on inflammation and calories and weight, of course, because you can't neglect that. But his main priority was in relation to inflammation. That he was a big red meat eater. Red meat, meat and 3 veg, traditional meat and 3 veg on the plate every day. So we spoke about trying to make some modifications to his lifestyle, and that required a little bit of behavioral change on his end because he's used to it, and it's something that he knows when it fills him up. So the concern for him was, what if I do something different? Will I still feel that same satiety? And I said to him, take a leap of faith. Do it every second day. So reducing the quantity of animal protein from every day to potentially 2 to 3 times a week instead for him, alongside reducing the refined carbohydrates, alongside integrating more omega-3s, so integrating more seafood, tuna, salmon, sardines, which we'll talk about in a minute, I'm sure.
Yeah.
But so in his mind, in my mind, it sounded like I felt like it was a few things that we were speaking about, but I was just informing him. He went back and took it all on board. And within 3 months, he came back and he said, I feel more energized. I feel my pain is better managed. It's, again, not to be taken in isolation by itself, alongside a holistic approach, of course. And he felt better, and he lost a bit of weight, which is a bonus.
Yeah. So this is the difficulty in the people that we treat, and it's through no fault of their own. They're in the medical environment. They say, my appendix is inflamed and burst, so chop it out and I'm done. In pain states, in these chronic states, patients, it's quite hard to show patients that whilst a medication might help, an injection might help, the thing that's going to help the most is those small little habit changes, those small little lifestyle changes. I've come to see you for me because I know that I can tweak 1 or 2 things. And do I feel better about it? Probably yes. I'm certainly no worse off for it, and I've made some really little changes to my diet. I think I'm probably eating a little too much red meat, but maybe you and I can discuss that offline. how long did it take for him to feel better? What do patients expect? Because they're not going to wake up one day and go, I'm okay. Like I said, behavioral change, looking after your body when it comes to pain. So, for example, patients say it hurts, I'm not going to exercise. And you've got to flip that on its head and say, well, that's fine. But it's the not exercising that's making you stiffer. It's making you weaker. It's making you more deconditioned. So actually, we've got to get you moving. And once they understand that it's okay to move their body, the movement is not damaging their body. They get into this positive spiral. And that sounds like exactly what you've done. Some patients are just ready for change. They want to make a few changes. They're open to something a little different. How long did it take for him, and what did he feel? Did he it was a gradual thing?
Yeah, good. It's really good reflection there, Nick, because first of all, nutrition's everyone's business.
Yeah.
Just because I'm a dietitian doesn't mean I know it all. And even if I know it in terms of theoretically, practically on a day-to-day basis, I need to constantly check in with myself. So without obsessing, obviously. So I guess in terms of what you would expect, I guess like you said, because it's a behavioral change, because it's a lifestyle change, because it's a chronic condition. So chronic pain is not something like I pop a tablet in, I'll feel better, I'm all good, off I go. It's a lifestyle change. It requires a lifestyle and a mindset change. And like you said, if someone's got barriers up, in terms of why I shouldn't be doing it, there's definitely enough more pleasure than pain around what they're currently doing. And sometimes the fear of the unknown is something that people fear taking that next step. So I guess what I would suggest there is every person's different, obviously, depending on what they're presenting with. But I would say, within 3 months, you should start seeing an improvement. You'll definitely see an improvement in your mindset over time. But in terms of inflammation and taking it in a holistic approach with the right mindset, I would say, give yourself 3 to 6 months to really exhibit changes and exhibit improvements. Although in this client that I was talking about, he showed improvements within 2 months. But I guess in his case, he was just needing that little bit of extra support to just tip him over in a positive direction. He was ready.
Yeah.
But sometimes people are just on the fence in their pre-contemplation going, yes, no. And I guess as a health professional, you need to really gauge where a person's at. And instead of wrestling with them, dance with them a little and then challenge them a little bit. So I've always been taught to dance and wrestle with clients. So, if we're always on their side, then nothing's going to change sometimes. Sometimes we need to challenge them and not wrestle them like pin them down to the ground, but, wrestle with them in terms of challenging them. So definitely, see where a person's at, meet them where they are, inform them, and trying to find a little opening for them to be motivated to change.
Yep. Got it. All right. Let's move on. Let's talk about the anti-inflammatory diet. I want to give people real things. So you've mentioned the Mediterranean diet. What is it? What does it look like?
Question. So the Mediterranean diet is ideally a lifestyle that you would lead in terms of food. It basically integrates less animal fats, less animal proteins. So the idea would be to kind of limit your red meats and your white meats, your animal proteins, to 1 to 2 days a week. And the reason being is, like we've mentioned before, higher in saturated fat. Even if it's a leaner form of animal protein, it's still animal protein. So reducing, and remember, there's no one food that's a superfood that's got everything. So by saying yes to so many things, you're saying no to other things. So by introducing a lot of red meat, a lot of animal protein in your diet, you're potentially reducing the opportunity to have less of other things. So 1 to 2 days a week of your red meat, and 1 to 2 days a week of your white meat, so 2 days a week of animal protein. And then the rest of the week integrating between plant-based protein and seafood. And the reason being is because we want to increase the omega-3s. So not only are we trying to reduce saturated fat, we're trying to increase what we call your unsaturated fat, your omega-3s, which are actually hugely emerging evidence around anti-inflammatory.
Okay.
So that's a real winner there.
So what things have got omega-3? You said fish, any fish.
So deep oily fish generally. So things like tuna, things like salmon, things like sardines. And I know often people will be thinking sardines, oh, how do I have that? You can make it happen. So the good thing about sardines is you can flavor them, you can mix it, you can kind of mash them and add them onto your toast with some other things on there. But yeah, sardines are actually great in omega-3s, very high in omega-3s. A can of sardines, in fact, is also quite high in calcium, and calcium is good for bone health. And often what we find is with chronic pain, if people are on quite a lot of steroids in terms of their pain management, steroids increases your risk of osteoporosis. We really need to look after your bone health. So a can of sardines, for example, is equivalent to about 3 eggs.
Right.
A can of tuna.
So less red meat, more oily fishes,
Yes.
and then I presume it's the greens and the legumes, and what else? What other specific things?
So in terms of omega-3s, yeah. So in terms of omega-3 proteins, you're looking at your oily fish like your tuna, your salmon, your sardines. In terms of other things as well that are high in omega-3 proteins, in terms of lentils, in terms of tofu, in terms of beans, plant-based in that way. In terms of quinoa, that's also quite high in omega-3s. And then omega-3s that are non-protein based, things like avocado, olive oil, they're quite high in omega-3s. Nuts are also quite high in omega-3s. They're quite high in protein. They're a great snack to have, and a little goes a long way. So that's in terms of protein.
Any particular nuts?
Ideally, things like almonds, walnuts, Brazil nuts. Trying to obviously deter away from things like, your macadamia nuts and your cashews. But if they're part of a handful of nuts to just add a bit of flavor, I'm not going to say no to that.
Why not macadamia nuts? I thought they were quite good in terms of, is it protein? I mean, not protein, energy?
Yes, but I guess in terms of when we're looking at omega-3s. We're trying to obviously increase the ones that have high omega-3s. But yes, all nuts generally are high in omega-3s, but there are ones that have got higher omega-3 levels than others.
Right. And you mentioned nutrients, omega-3, very important. Emerging evidence. I'm sure we'll find some papers to stick in the comments below. What other nutrients are important that you know about that act as anti-inflammatory compounds?
So things like vitamin B12, magnesium.
Magnesium, okay.
Yeah, magnesium, vitamin B12. Often people find things that help with migraines are things like coenzyme Q10.
Yeah.
Helps as well in that regard.
And are these supplements that people should be looking at buying, or is this just in the Mediterranean diet? Do we need to supplement ourselves?
Yeah, good question. The Mediterranean diet will present itself with those, but coenzyme Q10 is something you might want to take on the side, because remember, it's a chronic pain condition. So it's kind of a little bit more heightened level of not a little bit more, a lot of more heightened level of pain than an average person. So sometimes we just need to take a person to that little bit of an extra threshold, and then, see what's also sustainable and manageable for them. So yeah, the Mediterranean diet will present itself with all of that.
Got it. I've got a couple of notes here. What about vitamin D? Where does vitamin D fall into all of this?
Good question. Vitamin D was another supplement that I was actually going to talk about. But yes, definitely. Vitamin D is really, really important in terms of bone health, but it's also really important in terms of pain and inflammation and immunity.
Yeah.
There's a lot of emerging evidence, again, looking at vitamin D and its manifestation of chronic conditions later down the track. So yes, vitamin D is definitely important.
And I've got another one here called polyphenols, curcumin and resveratrol. Is that a thing or not?
Yes, it is a thing. It is a thing. Again, not on its own, but as part of a health and lifestyle. And what you'll find is by integrating more of those herbs and spices, you'll be reducing your added salts, for example. And salt is one thing that can heighten your level of inflammation.
Salt is bad. Okay. Let's move on. Let's talk about some myths, pitfalls, misconceptions, things that you find when you talk to patients. I've got some things in terms of fads. Is gluten a thing? Where are we at with all the fads at the moment? What's good? What's not?
Yeah, there's a lot of fads out there.
Yeah.
And social media and TikTok are just through the roof at the moment in terms of what works for some person is going to work for the rest of the world.
What's the one thing that pops into your mind, like the top thing that you go, oh my God, what is that all about?
One thing that crossed my my socials a few weeks ago is, and I think it's just because it's just a catchy thing at the moment, is Ozempic.
Okay.
But they didn't call it Ozempic. They called it Oat Zempic.
Oat Ozempic.
Oat
Do tell.
Zempic, yeah. And I guess having obviously a nutrition background, I was like, oh, I just want to know what this is all about. And I guess because Ozempic is something that's very catchy and very out there at the moment, and people are
Yeah.
using it off-label in terms of it's indicated for type 2 diabetes management, but using it off-label in terms of weight management.
Yeah.
And because it's inaccessibility worldwide, because people are using it in a viral way, I guess, people are trying to find other ways of, one, being cost effective, two, still getting the same effect. And this Oat Zempic is, something that came through my feeds, and it was an influencer that's, I don't know, 200,000 people follow her, where she's got a good number of people that are kind of keeping an eye on what she's saying. Basically, what she was kind of trying to advertise was Oat Zempic, which is oat, which is high in fiber, which is, yes, would be down the Mediterranean diet, very high in fiber, very anti-inflammatory, but taking it to the next level and using it as basically a medicine to integrate it with lime juice, with water, to make it into a bit of a shake. And
so oats that you buy in the shops.
Just straight rolled oats, $1.20 a big pack. That's just, rather than $300 a pop for Ozempic. So I guess what she was trying to indicate is this is really good. It's healthy, which it is healthy. It's going to fill you up, which it is going to fill you up because oats do fill you up. They're low GI. It's, however, not a superfood. It's not going to give you everything that your body needs. So first of all, it's at the cost of other nutrients that your body will be lacking. There's no protein in there, so you're lacking protein, and you will lose weight because you're in a calorie deficit. But one, you're not going to sustain that. And two, it's going to be at the cost of malnutrition. So I guess that's one thing.
Yeah, you're going to lose muscle.
You'll lose muscle. And yeah, there's a lot of emerging evidence that you'll lose muscle with other GLP drugs as well. So yeah, so I guess, don't take things like you see like that with a grain of salt. Inform yourself and say to yourself, in the short term, it sounds great, but there's no benefit.
It's not a good thing. Nothing like a good balanced diet.
Yeah, of course.
What other fads are out there? What are the things that patients might be doing that may be bad for them, that may not be good for them?
Yeah, I guess unnecessarily avoiding nutrients that your body doesn't need to avoid. So for example, going gluten-free to manage inflammation. That's something we often hear. And I guess often people feel that gluten is inflammatory. Gluten is carries itself in foods that have carbohydrate, but gluten is a protein as well. And what people often find is when I cut out that food, I all of a sudden feel better. And it's like a Band-Aid effect. You might feel better because you're purely just making a transition from what you were currently eating to what you are currently eating now. So that in itself may just be the reason why you feel better. But it doesn't necessarily mean it's getting to the underlying issue of the why of the inflammation. So, often we try and put a topical Band-Aid on our issues just because it feels good and we feel better, but we're not getting to the underlying core issue. So I wouldn't remove gluten unless you need to remove gluten.
When do you need to remove gluten?
Yes, you would need to remove gluten when your body can't absorb gluten, or when you have what we call IBS, irritable bowel syndrome, or FODMAP. And when you can't absorb gluten, that's a condition called celiac disease. That's an autoimmune condition where your body decides to just go against gluten. And when you have it, it wipes out all that microvilli in your gut that helps with the absorption. And so then all of a sudden, when you wipe it out, you feel better, but it's not necessarily always better unless you have to cut it out. So unless you've got celiac, unless you've got irritable bowel, unless you've got a bit of FODMAP, sometimes what also tends to happen is if you've had high doses of, antibiotics over the years, or high levels of stress where your gut bacteria and your gut flora is literally wiped out. Sometimes what we do is we find that when we cut these things out, we just all of a sudden feel better. But it's actually because you've just gone on a bit of a detox, really.
Right. Okay. I sometimes tell patients that low carbohydrate diets, ketogenic diets may be beneficial in terms of inflammation. Is that true? Would you agree with that? Do you support that?
Yeah, I hear you there, Nick. I think, look, it's not a massive no, right? But I think as a society, as a Western society, we do overeat in the carbohydrate component. And carbohydrate is a macronutrient. It provides you with a lot of fuel for your brain, for your muscles. So I think we can overdo it. However, what tends to happen is when we go carbohydrate free, we replace it with other things that your body wants and needs to give you fuel, to give you energy. And what can tend to happen there is by doing low carb, you're doing high protein. And by doing high protein, that can potentially put you in the direction of increasing your animal fats, increasing your saturated fat, and defeating the purpose of what we're really trying to achieve in terms of inflammation. So I think there's definitely a space for low carbohydrate. There's definitely a space for integrating more protein, but I think people need to be educated around when we're cutting down carbohydrate, it's not going carb free. Because when we're going carb free, you're potentially reducing your opportunities to have fiber, to have grains, all those foods that your body really needs for bowel function, for health, for cholesterol. And by increasing protein, you're potentially putting yourself in that risk of increasing your animal fat. So there's definitely a space for it, but it needs to be with supervision, with education, with seeing a dietitian, so that you can get that robust info.
So what I'm hearing is there is no one size fits all.
No.
In terms of nutrition management and health management.
No, yeah.
That's
we're all
trick.
uniquely different. So, yeah.
Okay. So let's move on to the kind of final part of this all. If somebody is listening today, I want them to have some things, like I've said previously, things that they can do straight away. Where do they start? I mean, should they have a DIY approach to this? Should they see a dietitian? Should they come and see you? What should they do straight up?
I think if someone is really interested in improving their health and well-being, they should inform themselves first, because we live in a world where everything's at our fingertips. You should inform yourself, look into the research, look at what's out there, and definitely come to a dietitian to discuss that. Because gone are the days where you go see a health professional, they tell you what to do, off you go do it. You need to be informed, because when you're informed, you're more motivated. When there's an intrinsic motivator, you're more likely to sustain that. So I would suggest the take-home message is inform yourself, look at what's out there, go see a dietitian, take a leap of faith. We're not the food police. We're here to be on your side. We're here for the long term, not the short term, with you. And we're here to support you. So I think take-home message is inform yourself, go see a dietitian. And then from a dietary perspective, nutrition's everyone's business. So surely there is something that we can take home and make a change to, whether it's, for example, integrating some more, plant-based protein, omega-3 protein, reducing animal fats.
So there's a lot of information out there, and a lot of it, like you said, is probably junk. A lot of it comes from inexperience. A lot of it comes from ignorance. Where can people get good information?
Good question. So obviously in the chronic pain space, you can go see a dietitian, come to pain specialists. We support people through telehealth as well, but also obviously indicate that you do need to make a change, which often is a bit of a harder one to kind of accept. But go see professional help. Go see someone with credentials, with credibility, who you get along with and have rapport with. And sometimes, like we said, it does take a leap of faith, because you might trial something and it doesn't work out. And it doesn't, nothing against the person, nothing against you. It's just not a good match, not a good fit. But it's not against the profession itself, not against the education itself. So go see a dietitian, go see a multidisciplinary team. Anything with a chronic condition requires a multidisciplinary team.
All right. Well, I guess you and I are going to have to knock out a quick blog article before we publish this, so we can stick the link below so people can go and have a read on it. So we'll get that sorted ASAP. Let's talk a little bit about some key take-home messages for listeners as well. Mediterranean style pattern is based by a lot of strong evidence. Tick. Include foods rich in omega-3, so oily fish, flaxseed. I think those are the big ones. It's the oily fish, correct?
Oily fish, flaxseed, nuts, avocado.
Avocado, good. cut back on refined carbs and processed sugars. And again, it's not stop because that's a big deal, but it's dial back down. Balance meals with whole ingredients, easier said than done. We're all busy people with families, but it does make a difference. Prioritizing nutritious snacks over calorie-dense comfort foods. What does that mean?
Good question. So often comfort comes with a sense of relief and alleviation. And so often in the short term, that's what you'll get by having something that's wholesome and decadent and creamy and nice, but it doesn't necessarily hit the spot. So things that are more nutrient dense rather than calorie dense, and things that are high in fiber and high in protein are things like, for example, nuts, yogurt, things like fruit, things like, some cereal, even, for example, things like hummus with crackers, or some vegetable sticks, things like that. But I mean, it's not to say cut them out completely, because there's a time and a place for everything.
Sure.
But it's just to say if it's becoming more of a regular thing, then time to peel back.
Got it. Number 6, limit alcohol, especially with medications and especially if you're using too much of it.
Yes.
Okay. And then finally, think long term. I suppose what you're telling me and what I'm hearing is it doesn't have to be perfection. It's just consistency. It's just showing up, making those small little changes, testing and learning, trying again, adding something else in, and slowly over time you make those changes. I suppose, do you need a coach? Do you need somebody to, check you along the way?
Sometimes we do need a level of accountability.
Accountability, that's it,
Yeah,
accountability.
yeah. Sometimes we do need a level of accountability, because what often happens is when it's something that it's got a lot of fluidity and a lot of choice, we can kind of, I guess, justify our behavior. And because, we don't like to feel in a level of discomfort, we can justify our behavior and over time recondition our pathway and our way of thinking to a new direction. So definitely having someone on board to be accountable to, but not dependent on, because at the end of the day, you need to self-manage. You need to have confidence within yourself and your own compass. But definitely in the early stages and every now and again, definitely checking in. Absolutely.
Right. So finally, just to wrap things up, because I know you've got patients to see and I'm going to have patients to see as well. You've got the floor. Is there any final remarks you'd like to say to people out there suffering, struggling, lost in pain?
Don't lose hope. Don't lose hope. And I think what often happens is when you get to a level of quite depleted and quite defeated space in terms of your pain, know that the only way forward is up. So take a leap of faith. You are not alone. Small changes make a huge difference, and Rome wasn't built in a day. So see a dietitian.
Rome wasn't built in a day. That's fantastic. Thanks, Sherie.
No worries. Thanks for inviting me, Nick.